Hi, I'm Claudine Wong from KTVU Channel 2 News. Welcome to a forum of candidates running for the office of Contra Costa County Supervisor for District 4. District 4 includes Pleasant Hill, Concord, Walnut Creek, and Clayton. Today's forum is sponsored by the Contra Costa Elections Division, the League of Women Voters of Diablo Valley, and the League of Women Voters of West Contra Costa County. We are recording these roundtables here in the studio of Contra Costa Television with some crew assistance from the city of Walnut Creek. The Contra Costa County District 4 Supervisor position responsibilities include adopting an annual county budget, which includes firefighters, sheriff, and the jail, sponsoring an annual audit of all county accounts, books, and records, and creating boards and commissions as needed. The candidates are Karen Mitchoff and Harmesh Kumar. Thanks so much for joining us. We drew lots before the show to determine the speaking order, so we are going to begin with Karen Mitchoff, and we want to start just really get us into what your priorities are as county supervisor.
There's so many. I appreciated what you put on the board, but we do so much more than that. Water, the Delta, that's a big issue. I've been working on that for not only the time I've been on the Board of Supervisors, but my previous experience working for two previous supervisors. We're at a very critical junction on the Delta, and I'm very excited, even though the Southern District voted to fund the tunnels. I think we've got a long way to go before they're built. Transportation in this area, there's more traffic, people are frustrated. What do we do about that? Affordable housing, maintaining and assuring that the county is fiscally solvent. We have a AAA credit rating right now, which allows us the highest credit rating you can get. That's come with a lot of hard work on the behalf of our county employees and management to make sure that we have money to provide all the different services and to make sure that we can pay good wages to our employees.
Okay. Priorities?
Yep. I think we have a very serious housing crisis in our in the Bay Area and especially in our district. And we need to do something, and we have a surplus county land. We need to build affordable housing on that surplus land for our teachers, for our hardworking families, for our first responders. And traffic congestion is a big issue, and affordable health care. People don't have to choose between buying a food and buying the health care for themselves. We have a lot of funds available in the county, and they are not being spent for which they are allocated. We have $45 million in mental health fund, Proposition 63, only in county, and we have AB 109 funding. Most of that funding is allocated, but it's not going to the right kind of services people need. So if I'm elected, I will make sure that all the funding is allocated and spent on the things which we say we are going to spend on.
Okay, I'm going to follow up and say, what do you think separates you two from each other as candidates? When people look on their ballot and say, who do I want to vote for, what are the biggest differences between you?
You see, on June 5th, people will have a choice to elect a candidate who supports people's right, especially our public employees' right to negotiate, or elect a candidate who will kind of support building more affordable housing on our county empty land, or they will elect a candidate who is for high-density housing on the transit corridors, or they'll elect my opponent who is for jail expansion, who is for school to prison pipeline, who is against bail reform, who is against the values for keeping our families together. So they will have a choice on June 5th.
Let me let you respond.
Well, I obviously disagree with Dr. Kumar, I actually work on all those things. It isn't jail expansion. We are providing a mental health facility. There will be no new additional beds added. So there is no expansion, and that's been well documented. I am for affordable housing along transit corridors, as I mentioned earlier. I don't agree that, I'm sorry I didn't understand one of the comments he made, but I am for affordable housing. Families and children. I worked for our Family and Human Services Department. Yesterday in our budget hearings, I made very clear when the director came forward how those monies were spent. In our Health Services Department, we've asked for an audit of these funds. We had no idea. And we have a new Health Services Director, and I've made it very clear with that new Health Services Director that we want better accountability and we want the board to know about that. I served on the Family Justice Center, which is a collaboration between police and the district attorney and those who have been impacted by domestic violence to make sure we have more services out there. I have a long history working with children and families.
So what defines you from your opponent on the ballot?
Experience. I understand the county budget. I understand how money is allocated. I understand the various funding streams, whether they're federal dollars, state dollars, or general fund dollars. We know that to get those federal and state dollars, we need to put dollars in. So how do you match those dollars for maximum use? And we have a great credit record, as I mentioned earlier, and one of the reasons is because we manage all of our fiscal accounts. You mentioned the audits earlier. I follow up on all that. I have a fiscal background. I have a understanding of how county government works, and that's the difference between Dr. Kumar and myself.
Do you want to respond to this question of experience?
You know, we have a lot of people with experience, but when you look at the results, look at the outcomes, we have homelessness in our county and our district growing on a daily basis. We have 400 kids sleeping in the cars at night and going to school in the morning, sleeping in the car. And this experience they have, what they are doing for that? Nothing. So we need a new and bold leadership to bring the change in the county. And fiscal responsibilities, if you are keeping the money, not spending the money, that will increase your credit rating. It is not about credit rating, it is creating more affordable housing, creating more services for people, making their life and quality of life more affordable and livable. And people are committing suicide, people are killing themselves under the pressure created by our policymakers.
Okay, let's kind of go towards specific issues then right now. Let's talk about homelessness. Mm-hmm. Where do you characterize that problem, and what do you think the appropriate response is in Contra Costa County?
It is unfortunate that we have a homeless population that is out on the street, but that goes to the fact that we have a lot of people with mental health issues, and I'll get to that in a minute, and substance abuse issues. I just met with our homeless director recently and talked with some other people. The people who are out on the street are those who choose not to partake of the services that we have. We feel that it's fiscally responsible if someone is homeless to get them into housing and provide services so that they transition to full-time housing with jobs and the services that they need. So we just got a $950 million annual grant from Housing and Urban Development to provide what you might call container housing, but I've seen it, it's wonderful, and we're going to be putting that into effect in Richmond. So the people who want to partake of our homeless services are partaking of them. Children and families are getting that, but there is a limit to our financial resources. And so we have a core team in Contra Costa in our district, that's Martinez, Walnut Creek, Pleasant Hill, that goes out every day and talks to homeless people, finding out what they need, what they can provide. So we are doing a lot for the homeless population.
So you think that if someone wants services, they're available. It's not a question of not enough services.
Right. I mean, it is hard to get into them, but yes, we want to get people into those services, and we can do that. We'll talk about mental health in a minute, because that's another issue.
We'll get to that in a second. Let's go to the homeless situation. Do you think there are enough services out there? Do you think the county is doing enough?
No, county is not doing enough, and there are not enough services. Sometimes people have to wait 3 to 4 years to get into services. Even Mount Diablo Valley Rehab Center, I work in mental health field for over 30 years. I started the nonprofit mental health agency in Concord to serve those chronically mentally disabled. It's not a pessimistic attitude that people don't want to get. Who wants to suffer? I think our leadership has a moral flaw or moral blindness that they don't see why people will suffer on the street. Who wants to be in the street? Who wants to be homeless? Who wants to be hungry?
There are stories where people turn down services.
There are people, but they are only very few, very selective people. We need to prevent those people getting there. And we have nothing on the prevention. We all wanted to, the money we are spending on the crisis management. We are not spending money on the prevention, preventing these people from becoming homeless.
So you're saying that people are going out saying these services are available, and that people are, the homeless are saying, I want services, and they can't get them.
They cannot get them, yes. And there are mental health issues associated with it, and that is a separate issue. We have the funding for that, but they're not spending it.
So I'll let you start on the mental health issue. Where do you think the mental health problem is in District 4, in the county, and what would you do as a supervisor within your power to change what's being offered?
You know, we have been spending so stupidly on mental health services. Our leaders are not paying attention to it. We have so much at stake, and this moral bankruptcy our leaders have created has created a lot of homeless. I was providing housing to mentally ill patients. We were being paid, people those who provide housing, 3 meals a day, they were being paid $33 per day per patient.
So specifically, what money are you talking about, and where would
there is a Proposition 63 money, and that's that money which the supervisor said that they got $950 million grant for the housing and other things. We need to create a creative ways. There are so many loopholes and bureaucratic niches people have created. And somebody needs to connect the dots and have the moral conviction that we are going to do it. And they have such a defeatist attitude. We need somebody, a strong leader there who could really navigate the system in favor of people, not in favor of the institutions, not in favor of the powerful elite.
I'm going to let you respond to that. Is there money that could be used that isn't being used to deal with mental health issues?
Dr. Kumar is correct. We found out that the state found out that a lot of counties were not spending grant dollars. We have been given the grant. We haven't gotten the money yet, if you will, because the money follows the services. We have not been able to get out and provide as much as we want to. And that's why I immediately called for a response from our Health Services Department, because this was news to us also. One of the things we hear is that we don't provide enough, there's not enough. Proposition 63 is what we call the billionaires tax, and it has to be used for specific things. The governor did take some money away from it to provide housing, and we fought against that because it's about mental health services. Housing can come out of another pot. But what Dr. Kumar is talking about, at least as I understand him, when we're talking about not enough money, he doesn't get paid enough in reimbursement, that is a state function, and we can argue that I'm deflecting or pessimistic, but I have to deal, and my board has to deal with the way we can spend money as it is. I have no control over Medi-Cal reimbursement. In fact, the county is on record in our legislative platform to make sure that no further dollars are taken away when bills come up for that, and to advocate for more.
But would you agree that more could be done, money needs to be found, and money that's not used?
Well, I would need to find out what's going on, because when we have, and we recently had our mental health director retire, and we have a new person on board. He knows that the #1 thing that we want back from the board is finding out about that $48 million that is sort of just sitting there. Part of it comes, unfortunately, from the fact that we don't have enough staff to provide services, and we can go out and do some contracting. But we instituted Laura's Law, which is a new program, comes directly out of general fund dollars. We don't get any reimbursement for that. That is to help the mentally ill who are adults. Because one of the problems with those who are mentally ill, when Dr. Kumar talks about nobody wants to sit out on the street and be hungry or cold, I would agree with him. But when you go to somebody and say, you have these issues and we want to do that, and they say, no, I don't. I don't have those issues. And if they're not engaged, how do you get someone who is an adult? You cannot force them to take services.
Would you agree with that statement, that it's a big challenge?
It is a challenge. It is a challenge how to get invested in people who has been discarded by their own family members, people those who have been thrown out their own families, people those who have been deserted by the government services agencies, how to get them back on track. People those who have been maligned, people those who have been told you are good for nothing, you are trash, you are white trash, you are this, you are that. How to get those people to agree to sit with you? It is a technical issue, it's a skilled we need, and we need those skilled people, and we have the funds to provide those skilled
That's
services.
why we have the core teams. That is their job, is to go out and engage with those individuals.
It's clearly a very complicated issue. We've talked a lot about funding, though, and needing the money to do that, which may lead us into the money that comes from marijuana sales. Where do you think that money should be used for? I don't know if you guys have even hard numbers of what kind of money we're looking at coming in and where that should go.
Once Prop 64 passed, everybody thought, oh, here is a new source of funding. Our board made it a priority that it would be for those who need those services. First of all, law enforcement, because we're going to have to increase law enforcement in order to enforce any ordinance that is passed. But secondarily, the money that would be realized from those marijuana sales will go towards alcohol and other substance abuses, so that we can get people who are impacted, not so much by marijuana, but opioid crisis, obviously alcoholism, whatever. We want to put more money into those services because there's just not enough. The problem is, we did have a study done by a sales tax consulting firm, and what was brought back to us was not as great as we thought. The problem is that the state taxes and then at the local entity taxes, where is that tipping point before people say, I'm just going to go back to the black market? What I am in favor of is, I've heard from a number of constituents, they want dispensaries and delivery in Contra Costa County because they find it difficult because of their physical infirmities for which they are taking marijuana, medicinal marijuana, to go to other locales. The issue here in Contra Costa is the recreational part. I'm only in charge of unincorporated county. I think a lot of people think that the board is in charge of every jurisdiction, and we're not. So every jurisdiction is taking this one city at a time, which are 19 cities, and then the county. And we're actually having a workshop on Tuesday to further review this issue.
And do you have a position on whether you would like to see recreational marijuana dispensaries?
I have no problem with that. The voters overwhelmingly said they do want that, and so if we are going to have that, I want to make sure the funding is there so I and the Board of Supervisors can provide those services that are necessary.
Your position on dispensaries in the county, in the cities, and where that money should go?
I think one thing where I come from, as I said, from the mental health field, it's a very unfortunate thing that when we talk about people suffering, if they take medical marijuana to deal with their pain, we are relating it to business and to the money. And that it's a paradigm understanding and shift. We need to have a mental shift. Once you provide these services for people, those who need it the most, money will come. But we need to have the parameters, we need to have the structures around it. And people have supported Proposition 64. People want recreational marijuana. And we need to have the rules and regulation around it at the local level. And people are so scared. This NIMBY phenomena, not in my backyard. We have a very flawed perception in our local districts to create these more relevant services for the people.
So do you want dispensaries to see more of the dispensaries
We
in
do
District
need-
4 in the county?
If people are going somewhere else to buy the same thing, we're doing the same thing to the liquor.
And where does the money go? So the money comes in, where does it go?
Money, if money comes, money should be we need to provide these services for drug and alcohol rehab, for mental health services. People, those who take these substances, there is some mental health component they are suffering from, and we need to get this money for that services.
Okay, let's talk about unfunded pension obligations from the county. Your take on that?
You see, this is a highway robbery which some of the retirement people and some of the policymakers have done over the years. People have kind of increased their retirement at the end of their tenure in the county. And if they were supposed to get salary 45,000, they increase it to multifold. And it is not only at the local level, at the county level, at the state level. We need to first close those loopholes for future pensioners so that we could keep our promises we made to them that they will get paid when they retired. And nowadays, to get a senior housing, it costs you $7,000 to $12,000 a month to have your parents, grandparents in assisted living. So we need to keep those funds which we have promised that we will give it to them, and we need to close those loopholes which increase those pensions.
Do you agree with that position, that there's some loopholes that are threatening the pension system here?
Not in Contra Costa County as far as the Contra Costa Employees Retirement Association. Perhaps in CalPERS, we are what's called a 1937 Act county. I actually served on the retirement board. When I ran in 2010, that was one of my #1 goals, is to get rid of this, what we called spiking and straddling, and we have. That is gone. Employees cannot do that anymore. Plus, the governor has put in place certain things to prevent that. We have what are called legacy employees before PEPRA and post PEPRA. But having served on the retirement board, and another supervisor now serves there, it's one of the reasons that we had quite a bit of discord, if you will, between our employee labor organizations, because they felt this was something they should have. We have closed those loopholes. They've been closed for quite a while. You cannot straddle anymore.
So do you have pensions, though, that are unfunded, that are still?
The unfunded pension liability comes about because of an accounting issue. They've always been there. There are government accountability standards that came into place that said you now have to carry these obligations on your books. We have pension liability bonds. We are paying those down. They will be paid off in 2022.
Okay, so let's go out into the unincorporated areas. You mentioned a little bit of that. Where do you think the work needs to be done in outside of the more heavily populated areas of the district? We'll begin with you.
Well, for one thing, District 4 is the district that has the least amount of unincorporated area, and basically the supervisor only has authority or control over that, although the entire board does. One of our biggest assets in the unincorporated area is the Pleasant Hill BART station. So yes, we have a lot of unincorporated area throughout the county. We have an urban limit line in place, so there's a lot of places where we cannot develop. That has been by a vote of the people. But I'll get to the Pleasant Hill BART station because that is a transient occupancy development. I sit on the Association of Bay Area Governments. It has been long planned, and this goes back to my service with former Supervisor Sonny McPeak and Mark DeSaulnier. We do have high density there. We have affordable housing there. We've cut back on how many people or how many cars renters and owners can have there, so that people would like to take transit there. We've gone through a major recession, and now we are going to have some building. And so that is where the county, I see that as an asset that improves, brings in dollars, tax dollars, that we can use in other areas of the county.
Your thoughts on the unincorporated areas of District 4?
No, as I said, in this district, we have very few areas which are unincorporated. But the one we have, there are so many bureaucratic holes, as I said earlier, which are impeding the progress we want to make. And some of these bureaucratic holes which have been created by these policymakers, we need to dismantle them. And we need to provide the funding for which there is quite a few empty buildings in county, in even District 4. We need to dismantle those buildings and create more affordable housing for our teachers. In that way, we could keep those great teachers in our district. We have many things available which are not being used by the policymakers.
Okay. Well, we've come to the point where we can thank you guys for answering the questions that we put out to you. Each candidate is now going to have 2 minutes to make a closing statement, and we start with you.
Okay. On June 5th, you will have a choice to elect a supervisor who will support our employees' right to negotiate, a candidate who will support building more affordable housing in our transit corridors, a candidate who will support building more affordable housing for our teachers, our first responders, and keeping them in our district, a candidate who will support affordable health care for everybody, or a candidate who is for jail expansion, who is for school to prison pipeline, who is against the bail reform, who is against the values to keep the families together. I ask for your support. I ask for your vote. I won't let you down on June 5th. Thank you so much.
Okay. Your 2 minutes.
Thank you, and thank you for watching this interaction between the two of us. I think you will see that there is a difference of opinion on what the issues are and how to solve those issues. As I mentioned at the beginning of this, I'm fighting for the Delta. I have that background and experience that's needed as we deal with the state. Working on transportation, not only how to reduce traffic, and that's to bring jobs to the areas where people live so they don't have to commute. Working on affordable housing, that is not an easy issue. Government does not create affordable housing. Government creates the policies that help builders and developers who want to come into our community deal with affordable housing. I'm actually working with a developer right now at Pleasant Hill BART so that we can increase the amount of affordable housing. I want to make clear that I am not for jail expansion, that I have always worked for people in this district. I believe in local control. I believe that the voters have spoken on certain issues. I have the experience to understand what the actual funding streams are and how they can be appropriately allocated. Yes, we can do it better and try and get laws changed, and we are working with our state legislators and our federal legislators to assist us in that matter. But while those laws haven't been changed, I have to deal, and my board has to deal with what we have at this point. I am not for school to prison population. That has nothing to do with the Board of Supervisors. And I hope that we can bring affordable housing. But we live in a very expensive area, and one of the concerns is that land is expensive. And when land is expensive, which means your home that you own, you want to get the best value for it. So that is the paradox that we have land, and I disagree. We do not have property here in Contra Costa County that is available, that's county buildings that is not being used.
All right. Thank you. And we are out of time, but we want to thank you both for being a part of this forum. That does conclude our forum of the candidates running for office of District 4 Supervisor in the June 5th primary election. Once again, our candidates are Karen Mitchoff and Harmesh Kumar. For more information on the candidates, you can go to the website votersedge.org, and to view this broadcast online, you can go to www.cocovote.us. I'm Claudine Wong from KTVU Channel 2 News. Thanks for watching, and don't forget to vote on June 5th.